The era of African medical dependency on the West is crumbling right before our eyes. This isn't just a news story, it is a declaration of sovereignty. A local surgeon in Nigeria is preparing for a massive medical mission, and while the Western media might overlook it as just another clinic, we see it for what it truly is, a brick in the wall of African self-reliance. We are witnessing a tectonic shift in how the continent handles its most precious resource, human life. For decades, the narrative was that Africa needed Western saviors to provide advanced care. But today, the tide is turning. We are covering the specific details of this upcoming Nigerian mission, the infrastructure it represents, and why this marks a pivotal moment for medical independence across the entire continent. To understand where we are going, we have to look at where we started. For over a century, African healthcare was structured under colonial frameworks that prioritized Western interest. We were taught to export our skilled professionals while importing high-cost solutions from Europe and North America. This created a cycle of dependency. However, looking at the broader landscape, including how nations like South Africa have begun to innovate in specialized medical fields, we see the cracks in that old system forming. The infrastructure is being rebuilt by African hands, for African people. Now, let us look at the current situation on the ground in Nigeria. This surgeon isn't just preparing for a one-off event, they are participating in a move toward localized excellence. By training locally, using local resources, and solving regional problems, these doctors are proving that the West must come to save us narrative is obsolete. They are building a sustainable ecosystem where patients don't need to fly across oceans for life-saving procedures. Like this video help more Africans see this story. Who are the key players here? It's not just individual doctors, it is a coalition of local governments, private healthcare investors, and regional partners. They are moving away from charity models and toward capacity models. Instead of waiting for a Western NGO to fund a clinic, they are building a system where Nigerian expertise becomes the gold standard for West African medicine. This shift requires immense courage, but it is exactly the kind of bold leadership we need to see more of. But here is the most important part: what does this mean for our continent? When Nigeria succeeds in perfecting its medical infrastructure, it creates a blueprint for Ghana, Kenya, and beyond. This is the Africa Rising narrative in action. We are talking about the creation of a Pan-African medical corridor where specialized skills move freely across borders to serve our people. We aren't just building clinics, we are building a continent that can heal itself without asking for permission from the global north. What this means for the future is simple: sovereignty. When an African child can receive world-class surgery in Lagos or Abuja, the West loses its leverage over our health. We are moving toward a future where African innovation leads the way in biotechnology, pharmaceuticals, and surgical techniques. This is about pride. It is about the realization that we already have the talent, we just needed the space to lead. Subscribe for honest, Pan-African analysis you won't find on CNN or BBC. The future of Africa isn't being written in Brussels or Washington, it is being written right here in our hospitals and clinics. Check out this next video where we discuss how African technology is revolutionizing agriculture across the continent. We are building a new world, and it starts with our health. What do you think about Nigeria's move toward medical independence? Let me know in the comments below. I want to hear your thoughts on how we can further support local doctors.